Thank you very much, Mr. Chairman. Thank you all for being here. This is a very important hearing. It's important because, well, we are focused on this particular company and this set of horror stories. What is happening in your hospitals is happening all across the country. I wish this were not true, but there are hundreds of Ralph de la Torres who are making a disgusting fortune off of withholding health care from people in need. So I just want to tell you a quick story about what's going on in Connecticut. In 2016, a company called Prospect Medical Holdings that is owned by a private equity company, Leonard Green and Partners, bought 3 hospitals in Connecticut. 3 small hospitals, Manchester Hospital, Waterbury Hospital, Rockville Hospital. You know exactly what happened. Immediately, they started stripping services out of these hospitals. Same story you're telling. All of a sudden, supplies started running short. All of a sudden, specialists couldn't be found because they were cutting them off of the rolls. The elevators stopped working in these hospitals, just like they did in your hospitals. By 2018, these hospitals were in trouble. Everybody knew it. Prospect was looking for a new buyer to just flip the hospitals to make more money. In that year, in 2018, Leonard Green took $658 million in fees and dividends, as these 3 hospitals in Connecticut were essentially dying in front of our eyes. Patient quality was being compromised. John Dankel is the managing partner of Leonard Green. There's a lot of various reports about how much he's worth, but likely in the neighborhood of $1 billion. I mean, how have we let American capitalism get so off the rails, so unmoored from the common good, that anybody thinks it's okay to make $1 billion off of degrading health care for poor people in Waterbury, Connecticut? A, how do you live with yourself? But B, why do we accept that as a country? This is just a choice to decide to commoditize our healthcare system in Connecticut, in Louisiana, in Massachusetts, in every state across this country. And we have enough data at this point to know quality is worse, often way worse, when these private equity companies come in, and not just in hospitals, in nursing homes. The death rate in nursing homes owned by private equity companies is 10% higher than in those not owned by private equity private equity firms. And so there's no mysteries of what's going on here. Ms. McGinnis, I wanted to just ask you a simple question. You've talked about this before, but I mean, let's acknowledge that every hospital has to make money, right? You have to make money in order to operate. So nobody begrudges a hospital for making decisions that allow it to make more money than it puts out. The question is this: are you making money for the purpose of providing good health care, or are you making money for the purpose of making the owners filthy rich? And every decision that happens in a hospital is different if you are making money to provide good health care versus making money to make the owners filthy rich. You were there before and after.
Yes, I was.
So just in the remaining minute, tell us a little bit about what it was like on the ground floor before this company comes in, right? And then after the company comes in. Can you feel it as an employee, the difference in the value system of the owners?
Yes, it's noticeably different. I used to work on an interim coronary care unit, and we gave the best care. We took care of some of the sickest patients outside the ICU, and we gave the best care. We had a 1-to-3, a 1-to-4 ratio. I never, ever, ever in the 2.5 years that I worked on that floor, we never had a code. And that's because we were able to rescue our patients. We had enough eyes, enough hands, good assessments, good monitoring, enough nurses around, frankly.
Because the focus was
Because the
providing
focus
good care.
was, yes. And when things got tight, what Caritas Christi did is they let go assistant nurse managers, and then they let go other people. The very last thing that they did, and they actually never did, was get rid of staff nurses, get rid of bedside nurses. They kept us well-staffed, and we took the best care of our patients. I was so proud to work at St. Elizabeth's. And after Stuart took over, it's just acts and just taking away everything, violating agreements that they made with us. They laid off all the nursing assistants on our maternity floors. Imagine running a maternity floor with no, well, I can tell you as a nurse, it's an absurd prospect. They lay off our educators. Now they're cutting right where for patient-facing staff, whereas Caritas Christi absolutely prioritized that to the point where they stopped funding our retirement plan. They took away a lot of other things before they took anything away from our patients.
Because the purpose is now
to take care of
making
our
as much money to make the owners filthy rich, right? And it's just when there is a fundamental difference in the purpose, there's a fundamental difference in what happens inside that hospital, and that's just the reality.
Yes.
Thank you.
Absolutely.
Thank you, Senator Murphy. Senator Cassidy, did you want to